everyone. Let me actually begin by setting the stage, since I'm on stage, and believe you me, I just heard about this 2 days ago. Today, 1 out of 4 premature deaths in the world are related to environment risk factors. Air pollution isn't a haze in the distance. 1 out of 9 deaths, which is 6.5 million people, die due to exposure due to indoor and outdoor air pollution. And this is not a first world or a third world issue. This is an everyday issue for all of us. And Molly, I wanted to actually start with you. It's been a busy weekend for you. The Climate March, the World Asthma Day. But help us set the stage here, define the problem for us, bring it home for us here in the United States. How does the environment affect our health here?
Well, you mentioned the Climate March. It was really amazing. I live in DC, and thousands of people streamed into the city from across the country. And it was amazing and inspiring, but the thing that was, honestly, the thing I really take from that day was the heat. It was 90 degrees, it was humid, it was April. So this is the kind of day that we're going to experience more with climate change. And when it's hot out, that makes air pollution worse. So families are already in the US experiencing the impacts of climate change right now, whether it's poor air quality from a hot day or climate-fueled wildfires pouring smoke into the air, or even just pollen seasons, which are longer and stronger already because of climate change. So we are going to have to deal with those impacts. And in general, air pollution in the US, it's a significant health issue. You might be surprised to know that 40% of all Americans live in places where the air is actually unhealthy to breathe, officially unhealthy to breathe. That's 2 in 5 Americans where the air quality does not meet our national health standards. And so this air pollution actually contributes to many of our major health issues. Of course, it hurts our lungs. Air pollution can trigger asthma attacks, and it can make us cough and make us short of breath and increase lung infections, and it interferes with the normal development of lungs as children are developing. But it's not just your lungs. Air pollution also impacts your heart. It increases heart attacks. It makes your heart have irregular rhythms. It's generally really a stressor on the whole cardiovascular system. And it's not just the heart, it's also the brain. Air pollution can actually harm your brain. There's an increasing body of evidence that links air pollution with dementia and Alzheimer's. And then the pregnant woman is actually especially vulnerable to air pollution. If you are pregnant and you live near a major roadway, your baby's more likely to be born premature or born low birth weight compared to the baby of a mom who doesn't have to breathe that air pollution. So we can do better, we need to do better, and we know how to solve this problem.
I was actually looking at the air pollution levels in the city. We're all in the air today, and it's 10% lower than the WHO safety limit, so right here, right now. Kirk, of course, would love to get your perspective. This is not a domestic issue, this is a global issue, like we said. We know that it disproportionately affects moms, women, and children under 5, when it comes to the disease burden. When we talk about global vulnerable communities, countries which don't have stronger systems and structures, how does this issue affect them, and what do you see in your work there?
Yeah, thanks, Nali. That's a great question. I'll tell one quick story about the Climate March, and you mentioned that. And my wife and I live in DC with our 18-month-old, and we also went to the march, and it was incredible to see so many excited, pumped-up people defending our climate, trying to make things better, and it was also very hot. It was like Molly said, it was 90 degrees in April, and we took our 18-month-old down, like I said, and pretty soon we were hot. We had to find some shade. We took a break, sat down, and within seconds, Wyatt, his name's Wyatt, he's up running around, meeting people, eating grass, whatever 18-month-old kids do, And about a minute later, he comes back and he's waving a little American flag, which was like, oh no, who do we have to apologize for him stealing someone's flag, right? So, but we took a quick look at the flag, and on it was a little red ribbon, and on the red ribbon it said, Mom's Clean Air Force. Like, this is really crazy. We actually have a photo of him at the march on Saturday. So it was, I say this because, one, it's a great excuse to show off my boy, which, you know, as a father and mother, you always want to do that as much as possible. But it's also, the more important reason is because these movements are so important to the things we do. We need clean air. Like you mentioned, cities in the US still have challenges. So we have to have organizations and movements like this, and also like all of you, to stay engaged, to stay active, and make sure people are following up on what they say they're doing. So thanks so much to everybody. That's your question, sorry. Bye, Wyatt. So in a country like the US where there's still challenges, it's amazing to think about. We have so many resources and systems in place and policies and advocates. But in places where we don't have those things, in developing countries around the world, think about how bad it could get. And that's probably close to where it might be. It's a big issue people are trying to deal with. And luckily, here we do have those advocates. But it's a challenge that we're trying to overcome in a lot of different ways. And there's a lot of organizations working to do that. But one of the big that air pollution is having tremendous effects, especially as it's linked to cooking. Now, you wouldn't believe it probably, but cooking is one of the most dangerous things a woman can do in developing countries. It's unbelievable. And how does that happen, you think? Well, emissions, because these women are cooking over open fires with smoky fuels like wood or charcoal or cow dung even, cattle dung, inside a home. Often it's poor ventilation, it's coming right into their faces. So all day breathing the smoke, so the health impacts are horrible. And about 4.3 million people die every year from cooking emissions. So it's a big deal. In addition, it's a pervasive issue because about 3 billion people depend on food that's cooked over solid fuels. So that's how big this issue is. So we're trying to fix it. We're trying to get over these hurdles. The health impacts are massive. The climate, environmental impacts, but also for women. Women spend hours, up to 4 or 5 hours every day collecting fuel. So how can you expect a woman to get a job or to get an education or take care of her children if she's spending 4 or 5 days every day cooking or searching for fuel? So it's a massive issue. The Global Alliance for Clean Cook Stoves is trying to work to address it.
You know, I must confess, I do still remember the earthen cook stove my grandma used to use way back when, and it was one of the most delicious food I've tasted. But I, of course, at that point in time, didn't know, you know, how healthy for the air so the biomass cooking techniques were. But that's still a big part of cooking in a lot of communities in the world. Molly, bringing it back to you here, you've spoken about your own respiratory issues and, you know, how on what we call high quality air quality alert days it could get really bad. Would love to hear about your story there, but also the power of mobilizing, you know, partners, change advocates in your effort. And I do want to give a shout out to, you know, your organization, 1 million strong moms force, you know, advocating for clean air. So definitely a round of applause for you here. But the role of partners here, whether it's moms, whether it's, you know, your recent partnership with the Medical Society Consortium for Climate and Health, how can some of these change advocates come together to really create scalable change?
So I'll start with my story. Several years ago, I was having respiratory problems. I had bronchitis. I had been treated for bronchitis, and I didn't have bronchitis anymore, but I was wheezing, I was coughing, I was short of breath, I couldn't sleep at night. I was really uncomfortable. So I went to visit a doctor, and he looked me over, and he prescribed a rescue inhaler, an asthma inhaler. And I said, wait a minute, do I have asthma? And he said, well, I'm not really willing to go there. I don't really know, but just use this and you'll feel better. And I said, well, but why am I having these symptoms? And he said, I don't really know, but use this and you'll feel better. So I filled the prescription, I used the inhaler, and several months went by, and I did feel better. But a few months later, I had this light bulb moment. It was a hot, humid summer day in DC, and I had gone for a long bike ride, and my lungs really hurt. I was really uncomfortable. I needed to use my inhaler, and I suddenly realized that my symptoms were much worse on code orange air days, and those are days where the ground level ozone in DC is unhealthy. And DC actually has a lot of those days. DC is a city with really poor air quality with regards to ozone. And so I realized that I was feeling that pollution in my body. I wish that my doctor had talked to me about this issue, because as a patient, I want to know why. And then I realized that as a parent, I have 3 kids, I really need to know why. It's part of being able to take care of my kids. So just the same way as I limit their screen time or make sure that they wear bike helmets when they're out on their bikes, I also need to protect them from air pollution. But the thing about that is that this isn't something that I can do as an individual by making different consumer choices or changing out my air conditioner filter in my home. This is pervasive. That means it's a society-wide problem. And what that means is we need to have collective action to fix it. And so it's really important that these conversations happen. We have to be talking to each other about that, because we have to build political will collectively to demand solutions. We know how to fix air pollution, but it's something that we have to do collectively. So civic engagement is really the key. And that's why we're working with healthcare professionals to make sure that those conversations are happening between patients and their healthcare providers, and then those conversations are happening between parents who go out and talk to neighbors, who talk to lawmakers, and who say, we need clean air for our kids.
Great. And we're actually, J&J is a proud supporter of the Medical Consortium Society of Climate and Health. Who better than to make the case for climate than doctors themselves? So we really like the power and trustedness of that the community of the doctors doing great work there. So thank you, Molly. Sometimes I think that how big and the broadness of this issue, right? Environmental health is air pollution, water pollution, soil pollution, chemical exposures, climate change, everything. They're so multidimensional, so interconnected. Environment is probably one of those areas which touches each and every one of the SDGs, the Sustainable Development Goals. So with the magnitude of this issue, where do we even get started? And let's just focus in on air pollution here, Kirk. Like, where do we even get started to define this issue right here?
It's a tough question. To address major issues like this. Air pollution and cooking, while neither have their specific SDG, what they do have is impact on at least 10 of the 17 SDGs. So that said, you're not going to be able to reach, for example, the health goals that you have if you're not going to address something like cooking and air pollution. You're not going to address women's equality, gender equality, if women are spending so much time cooking or they're sick because of their conditions at home. So there's a good framework there, I think, that's already making progress, and I think it's going to continue to do so. And there's another thing you have to notice is that this isn't just a local problem, and the pollution that's over in a developing country isn't staying there. A study that came out in March found that pollution from Asia and China is coming across the Pacific and raising smog levels in the West. Now, people don't probably realize that, but these issues aren't staying at home. They travel the globe. Mm-hmm. And another stat that's interesting is in India and China last year, we found that up to 20 or 30% of all the outdoor pollution is coming from cooking. So women in their homes, and millions or billions of homes, that smoke is coming up and causing up to 30% of pollution in 2 of the dirtiest polluted air countries in the world. So those type of stats make you realize how pervasive and as widespread this issue is, and how drastically we need to address it. And hopefully y'all can help us tell some of these stories and all the work you do.
I would love to ask both of you the question we're all asking ourselves today. What do you wish were true for every family everywhere? I often think, shouldn't clean air be a human right? We all should have access to clean air and water. But a personal narrative or something you've seen in your family or your friends, what keeps you fighting for this? For a brighter climate future.
Well, I'll just mention that Tuesday was World Asthma Day, and I've been very, very disturbed by learning how much asthma impacts American kids. And I found out that 77,000 children are missing school every school day in our country because of complications from asthma. It's a huge burden on communities. It's a huge burden on families. It's a huge burden on healthcare. Of course, it interferes with kids' education. And for lots of kids, they go to schools where they get free and reduced price lunches, and it means they miss their most important meal of the day. So that statistic really keeps me fighting. And on Tuesday, we actually observed World Asthma Day by installing lunch boxes and lunch trays outside of Union Station in Washington, D.C. We put 770 lunch boxes down, and each one of them represented 100 kids who were missing school that day because of asthma. And I spent the day there talking to people who walked by to talk to us about what this was and what was going on. And one woman, Carlita, came by with her stroller, and she came to thank us for raising awareness on these issues. She said she had 3 kids with asthma, and her 4th child, her son, had died last year because of an asthma attack. He was 3 years old. And we know that air pollution doesn't necessarily, it's not the only cause of asthma, but air pollution makes it worse. We need to address these issues for Carlita and for her son, and that's the kind of thing that keeps me fighting for these issues.
It's a tough stories to hear like that, and I think for me personally, one of the biggest challenges for us is in trying to change the way people cook, and behavior change is hard for all of us. I mean, if you ever tried to hold a New Year's resolution or go on a diet, you know it's almost impossible, and we're trying to change a culture or a cultural practice that's been going on for centuries. People have been cooking over open fires for as long as fire was invented. So that part is a big challenge, and in Guatemala, we have one project that's specifically focused on behavior change. And we're taking everything from market activations to cooking demonstrations to bringing in local chefs to teach women how to use the stoves and letting them try them out. And so as part of this, we were going into homes and talking to people who have purchased the stove and have been using them for a while. And there was one home we went into specifically. A woman, Amalia, lived with her 2 kids and her mother-in-law and her husband. And she was telling us about all the benefits she sees from. She no longer coughs so much. Her eyes don't water nearly as bad. She's worried much less about her children falling into an open fire and burning themselves. She uses less wood and she saves money. We said, wow, that's really impressive. And she leaned in and she said, well, one of the other things that's been great is I kiss my kids goodnight every night and they don't smell like smoke. And my husband told me the other night, he said, wow, honey, you don't smell like smoke anymore. Mm-hmm. So it's those intangible things that really show you what kind of difference you're making. And for me, I guess it would be, my wish would be for everyone in the world to be able to go to bed at night and not smell like smoke.
That's great. Well, thank you both for connecting the dots between planetary health and human health. As a leading healthcare company, we certainly think there is a link. I wish every mom, every dad, every citizen here, we take care of our planet like our health depends on it, because it surely does. Thank you.